but with sexually transmitted disease. But here, Staphylococcus is most common in every neonate. So how you will differentiate it is Staphylococcus and it is gonorrhea. See, in gonorrhea or in chlamydia, there will be history of multiple sexual partner. There will be history of maternal, vaginal, purulent secretion. But in staphylococcal infection, Haemophilus influenza, mother is normal. There will be no history of maternal problem. But after delivery, the baby developed sticky eye, purulent secretion. Okay. Neisseria, gonorrhea, and chlamydia, they are almost similar. Secretion maybe, purulent secretion, here also purulent secretion. But here the problem is chlamydia has respiratory problem. Okay, that you can differentiate easily, that the baby developed conjunctivitis after few days and the baby has breathing difficulty. What is the organism? Chlamydia trachomatis, because they have respiratory problem. That's why we give azithromycin. Previously we give erythromycin, now we give azithromycin. Why? Because erythromycin has a high chance of development of hypertrophic pyloric stenosis. That's why we now give azithromycin eye drop. And also we give azithromycin orally. Topical, yes. Topical we give chlamydia trachomatis. And what is the treatment of Neisseria? Single dose of cefotaxime. Cefotaxime. So this is the purulent discharge. Now, there are some other treatment like Staphylococcus. So Staphylococcus treatment, what? Saline wash. Saline wash, yes. And you can give fusidic acid. No, Fluclox orally we don't give. We give fusidic acid. But if the baby has severe sepsis in the eye, we give IV Fluclox. Okay. So this is a treatment of Staphylococcus, saline wash, normal saline wash. And sometimes you can give fusidic acid ointment. Okay. Now another conjunctivitis there is, that is herpes. Which virus, herpes 1 or herpes 2? Which virus is associated?
Genital herpes.
Genital herpes 2. Yes. And this baby will be delivered by normally or cesarean section? What is the history?
Normally.
Normal delivery, yes. This baby, there will be history of NVD. NVD plus maternal HSV2 infection. So this baby will be infected by birth canal, right? What is the treatment of herpes?
If it's okay, the baby is fine, we didn't give a treatment, it's a reinfection. But if occurs sepsis or something like, we have to give acyclovir.
Yes, IV or oral acyclovir?
IV.
IV. Because neonate oral does not actually does not work. So we will give IV at least 7 to 14 days. We give acyclovir IV for herpes. If there is sign symptom, yes. Okay, now every case like Neisseria, gonorrhea or chlamydia or herpes, you should refer to the ophthalmologist, remember. And any baby who develop Neisseria, gonorrhea or chlamydia, you should do TOT screening of the mother or other antibody of the baby. Because, whenever there is a STD, sexually transmitted disease, there is chance of other STD. They are mixed up. So you should take care of that other STD. Okay. Any question from conjunctivitis?
No, ma'am.
Okay. Now, what about this chapter 80? Okay, we will discuss in the group if you have any confusion with any question related to neonatal guideline. See, developmental dysplasia of hip, very, very, very important. Previously, there was another name. What is that in this developmental dysplasia?
Dislocation of the hip.
Congenital dislocation of hip. Yes. Why they changed the name? Do you have any idea why they changed the name? Developmental dysplasia.
No more.
Even acha. See, previously it was thought that baby is born with this condition. So the name was congenital dislocation of the hip. But soon after that, scientists proved that no, this is a developmental condition. Sometimes, suppose you do a neonatal checkup, right? NIPE checkup. We do na NIPE checkup. NIPE checkup is done how many times after birth?
After birth
One
and
is
4
At
to
birth and at
6
6
weeks.
weeks.
Yes, 6 weeks after birth and 6 weeks. This is NIPE screening. Very good. So sometime when we check the baby at birth, baby is okay. At 6 week, baby is okay. But after 3 months, the baby present with, irritability. He cannot let the diaper change. She's crying on diaper change. Or the baby is having, mother will tell doctor, I'm observing that my baby has right and left limb are unequal. That is called Galliage sign, buttock crease, abnormal buttock crease. Mother will tell you that there is abnormal in the length of the both the leg. So that means the baby was not diagnosed, undiagnosed case. Why these things happened? Because nobody knows, this is an unknown cause, why the hip suddenly having problem in development. Okay, the baby's hip joint is not getting enough blood, or maybe not getting enough nutrition, or maybe some compression, maybe some trauma. Nobody knows actually the cause, but suddenly one side or both the sides, sometimes it is bilaterally. Bilaterally is 10 to 20%. Bilaterally, the baby's hip is not growing properly. So for bilateral developmental dysplasia, mother will not come to you. But unilateral, yes, parents will come to you. So this is undiagnosed and late diagnosed developmental dysplasia of hip. As I said, what is the cause? We don't know. But the problem is hip is not developing. So the affected hip will become short or long?
Short.
short, ma'am.
Leg
It
will
go
be short.
So
Affected
leg
leg.
will be short.
Yes. And the buttock crease will go upside or downside? Upside. Upside, yes. The buttock crease will go upside on the affected limb. Yes, the buttock crease. Okay. So remember, this is developmental dysplasia of hip. Now, the developmental dysplasia of hip causes, there are some F, family history, F, female, F, firstborn, F. So there is a rule of F. There is a rule of F in developmental dysplasia. Firstborn, female, family history, foot problem. Foot. What is foot? F for foot problem. Foot problem means calcaneovarus deformity, calcaneovalgus deformity, talipes deformity. Then fatty. Fatty means obese baby, more than 5 kg. Then fluid. So there is how many F? See, at least 6 to 7 F in the developmental dysplasia. Fluid, if the fluid is very low, oligohydramnios. Fatty baby, mane baby is very big. Or multiple baby, mane twin pregnancy or triplet pregnancy. Premature baby, neurodevelopmental disorder, or suppose baby has spinal muscular atrophy or muscular dystrophy. This baby, okay. Or any baby who has musculoskeletal problem like arthrogryposis or Klippel-Feil syndrome. Okay, these are the history of congenital dislocation of hip. Now, screening. How we will do screening for developmental dysplasia of C? Below 4 months, it is said that the hip joint does not, the center of the hip joint does not ossify. That is why below 6 months, the screening test is ultrasound. Okay, screening test, there is a difference between screening test and diagnostic test. See, the screening test means it is, you are not sure. You are just doing some baseline level test that is called Ortolani and Barlow. So Ortolani and Barlow are screening test, but diagnostic test below 6 months is ultrasound. Okay, ultrasound of hip joint. So remember, if the question comes, what is the primary screening test? The answer will be ortolani and Barlow. And if the question comes, what is the immediately diagnostic test you will do? Ultrasound before 6 months. And after 6 months, what we do after 6 months?
X-ray.
X-ray.
Joint, yes. Now tell me, what do you mean by ortolani and what do you mean by Barlow? I'm telling you, you tell me. Abduction you do of the hip joint by which test? Ortolani or Barlow? Abduction.
Barlow, ma'am.
Barlow.
Ortolani.
Barlow.
Barlow.
Barlow means abduction.
Bahar.
Abduction, it will be popped out.
Okay,
Yeah.
outward then Barlow. Abduction is outward, right?
Barlow is out.
Yes.
Like
Barlow
that?
is out.
Yes.
Okay.
We remember like Barlow means baire. In Bangla we call
Bahar,
baire.
Bahar.
Mane Bahar, yes. You will pop out. So abduction, you will pop out. Okay. No, this is reverse. This is reverse. Sorry. This is reverse. See, ortolani and Barlow. Barlow means you will pop out. Yes, pop out. Sorry, pop out. And ortolani, you will in. You will
In.
put the
Yeah.
head in.
Yes, ma'am.
Okay, ortolani is in and Barlow is out. Yes, now it is correct. Barlow means Bahar. You are using the head of the femur outside. This is Barlow. And ortolani, you are using the head inside. Now I will show you the picture and you will tell me which test is it. Okay, this is right side. And this is
Barlow.
left side.
Ma'am, right side is Barlow. Yeah.
Yes.
Left is
So
outward.
right side you are doing Barlow. And left side you are doing ortolani. Yes. Now tell me, which one is abduction and which one is adduction in this
Barlow
hip?
is abduction and ortolani.
Barlow is
Abduction.
abduction and ortolani is adduction.
Yes, correct. Now you tell me, suppose the baby has problem in this, baby has restricted movement on the hip, restriction, okay? You cannot do abduction, restriction on the right side, okay? So what will be the treatment of this restriction right side? You cannot make it Barlow or ortolani, you cannot. So there is a restriction. Mother is saying, doctor, I cannot change the diaper because the right side is very stiff. So what will be the treatment? The baby is suppose 4 week or 6 week old.
Beverly Harness.
Beverly Harness, very good. Beverly Harness. Beverly Harness is called, another name is called, which one? Abduction cast or adduction cast?
Abduction, ma'am.
Abduction cast, yes, because there is a restriction of the hip joint. So if you make it like that, you know, this is just like a strap. This is just like a belt. Here there will be diaper and here there will be strap. This strap will be attached with the baby's body and the legs will be apart like abduction position. And this will make the head of the femur in a accurate position. So if you do this Pavlik harness before 6 months, we use this Pavlik harness, it will make the joint in actual position, in a physiological position. That is the action of Pavlik harness. But you can use it at least 6 months, but more than 6 month age, you cannot use. Suppose a patient present to you more than 6 months, then what will be your treatment?
Open surgery. No, open surgery.
Open more than 6 months.
Close surgery.
Close.
Up to 2 years, it's closed.
Open surgery. Yeah.
Yes. So more than 6 months, we will do closed reduction. Like, you know, hip spica. We will give some rod here, hip spica. Okay. This is closed reduction. And open reduction, acetabuloplasty. Open reduction plus constructive surgery. This is done by usually 1 to 2 years. After, if the baby is very late presenter, like it coming after 1 to 2 years, then we'll do open reduction. Open reduction means you will cut down the hip joint. You will make it a reconstruction. This is open. What is the problem? Why you are doing so much thing, Beverly Harness, open reduction? Why? What is the danger of this thing? Because
When the neck necrosis.
no, actually there is a unequal leg length discrepancy. So leg length discrepancy, do you think very comfortable for the child when the child is walking? It is very uncomfortable.
And also the painful gait can also.
Yes, the child will develop painful gait. There will be osteoarthritis, complication, high chance of injury, osteoarthritis, necrosis, pain, limping. This is not normal. This is not good for the child. Okay. That is why we are so bothered about this thing. And as we said, sometime you cannot diagnose it by knife screening because the baby present late. Okay.